Ta-da! This is your host Vance here at Kopi with Vance. As usual, before we start our show, our talk session, coffee, the mark, and this time it's the coffee because need some dopamine. Yeah. So cheers. It's a great way to start the talk session with a nice cup of coffee. All right, so today's topic, we are back again on Wednesdays, 10 p.m. without fail. Like I mentioned previously on our weekly shows, that we have shows lined up with different experts on topics, the doctors coming on board, and we are covering all different kind of topics along the way. And today's topic is also one of very special to the woman, especially out there. We have Dr. Tham Siang Wai. He's a consultant gynecologist and a fertility specialist. Great doctor. We had a conversation before even we going live, and we shared lots of informative awareness sharing sessions. But apart from that, we also have our guest speaker, Dr. Harinder, who will also be joining us in about 30 minutes time. Today's topic, we're going to cover a couple of things that we have lined up, and also viewers actually welcome to ask us questions relating to the woman's health. We're going to talk about endometriosis. We are talking about its treatment. We're talking about fibroids. We're even talking about womb removable on certain cases, and is it safe, or what will happen if it's any side effects. We are also going to talk on irregular menstrual cycles, and a lot of interesting topics that's going to come up here. And Doctor is actually ready to jump on board. But before we bring in, and for viewers who are watching this, since it's a woman topic, and I think it's not taboo at all, right? Any information that's going out there as informative, it's all about creation of awareness. So I believe it should be discussed. Of course, with certain filtration, with certain, not really hiding information, but I think it should be known, right? And there's nothing to be shy about talking certain topics. So this is not a sensitive topic at all. And I know we have a lot of questions that's come up. Viewers especially have messaged me as well. So thank you for joining. Thank you in advance. If you do see the video, please do share and spread the information as well, so that more members or more publics or more Facebook friends actually can come and get this information, because like I said, it's a weekly show, 10 p.m. and here we are. All right, so without any ado, I'm going to bring my guest speaker, Dr. Tham. Hello, Dr. Tham.
Hi, good evening, Vance.
Good evening, sir. How are you feeling today?
Fantastic, but I don't have a cup of coffee like you do.
It's okay. It's okay. Later we are going to join with that.
Yeah, sure.
Thank you, Doctor, for joining with me in Kopi with Vance. It's my great pleasure to have a gynecologist as well to talk a lot of information on the current situation. And, you know, it's been there for a while. But, Doctor, before we even jump into topics, it will be a great pleasure if you can do an introduction about yourself. Doctor.
Okay, so I'm basically an obstetrician gynecologist, and I'm also a fertility consultant. My primary place of practice is in Ipoh GH, Ipoh General Hospital, but I do a bit of private practice in Sanford, Ipoh. So I graduated from India, my basic degree. I was a Government of India scholar. When I came back, I did my master's in UKM in Kuala Lumpur. And later on, I subspecialized in reproductive medicine in Australia. So after that, I came back to Malaysia, and I've been in Ipoh since then. I'm quite young. I'm only 54.
That's young, Doctor.
Yeah.
And it is good to know that you actually went around, like India, you went to Australia, then you came back to Malaysia. Probably you want to come back to Singapore. You can make one circle, you know?
I would love to. One day,
Okay.
one day. Yeah.
All right, Doctor. Thank you for that introduction. And I know we have viewers all standing by with their questions. So viewers out there, if you do have any questions for Dr. Tham and for myself, please write it out, and I will definitely bring it to Dr. Tham for his expertise to actually talk about. So we're going to talk a lot more information and in terms of women health as well. So Doctor, before we even start on after the introduction, after graduating, what actually makes you to be a gynecologist? I mean, it's a different office set. You know, it's a different office. You're not going in and treating flu or certain, surgeon, but you are a different part where you're actually bringing life You're taking care of the mother, you're taking care of the fetus and the baby. So it's a process, right? We are talking about development stages of the baby until it is passed to the pediatrician. Of course, it's like a baton. You pass the baton, but till then, you are in not say control, but you are in the care of the mother and the fetus. So maybe you want to talk a little bit of that, doctor. What makes you interest to join into the gynecologist?
Okay, actually, when I was a young doctor, I was a house officer. I was really interested in orthopedics. And one fine day, I woke up and I was doing my master's in obstetrics and gynecology. So I don't know what happened. But to me, it's a very interesting field because not only do you bring happiness to the world, you bring a child to the world and you make the couple complete their family. But also, obstetrics and gynecology is a field where you do medicine, meaning you treat diabetes, hypertension, stroke, and all sorts of medical disorders in the pregnant woman, as well as you are also a surgeon. You do cesarean sections, you remove ovarian cysts, you remove the uterus, you fix prolapses. Prolapses means the pelvic organs have dropped out from the vagina, so you replace them and you do aesthetic surgery too. For example, if you had a bad vaginal delivery and there's a bit of damage in your lower abdomen, well, we can also make it a little bit better, function better, look better. So I guess it's a mix of both medical and surgical field, which makes it so interesting.
Definitely, doctor. I mean, as you speak, we have lots of people are saying hi. They're also tagging a lot of their friends as well. So we have a good. You seem to be very popular in Ipoh. You got a
Uh,
lot of friend base there, doctor.
I just do my bit in society.
Doctor. I mean, I myself a father of three.
Mhm.
When we went through the procedure, I think gynecologists are very cool. The way they come in, they relax. If it need to burst the water bag or if they come for emergency, I do believe that you are always like a 24 hours 7 standby, and you have to attend to the both baby and it's full of excitement for the family, isn't it?
Yeah. Yeah, you're absolutely right. But then I tell you, behind all that cool and calm appearance, there's a heart beating wildly behind that. But we have to be cool. Yeah.
Very true, doctor. Very true.
Yeah.
So let's get started on the topic itself. We have a very good steady flow of viewers right now. Thank you, viewers. So if you're watching right now, please do share. Like I said, with Dr. Tham here, we are talking about women's health. He's a gynecologist, specialist, consultant, and a fertility expert as well. So we are going to talk a lot of stuff. So if you do have any question, please come put it on your comments, and then we try to get doctor to. Use his humble expertise to share with us. So, doctor, we are going to the question itself. So let's put it onto the gear one to get after starting up the engine. Every
Yeah.
baby that started as a, of course, sperm, and then it goes into a big cycle, and the whole cycle we know. But what is it like for 9 months fetus to develop into a stages like first trimester, second, and third? How life is like in the womb? What does it feel like? I mean, we all live from there, but as an expert, how will you categorize it, or how do you share it with us?
Okay, that's a very nice question, in fact, and very difficult to answer because we've been there and we
Yes.
cannot remember what we did inside there.
Yep.
But based on what I can see in pregnant ladies when we do ultrasound, right now at about 4 to 5 weeks of pregnancy, in very early pregnancy, you see nothing but a black little dot in the uterus, and at about 6 weeks, you can see a little fetal part inside. And this little fetal part will start to have a pulsating heart. And at around 8 to 9 weeks, this little baby with a pulsating heart, which does not have a shape, it is just a piece of organic material, will start wriggling around. It shows tiny little movements. By around 12 weeks, you will see the limb butts, the tiny hands and the tiny legs moving around. And this slowly grows to a complete baby by around 12 to 14 weeks. And after that, it's a matter of rapid movement around, rapid growth, increasing in weight. And sometimes you can see funny things. The baby playing with the umbilical cord, the baby playing with the fingers, and the baby playing with the you know where. It usually
Yeah.
happens in baby boys. So they can be a bit naughty. You know, boys are naughty even from inside the womb. So
Okay.
there's a lot of things going on inside, and I believe we are very inquisitive right from the moment we are in the womb. We discover things. We play with our face. We play with our umbilical cord. We play with our body parts. That shows how the human mind develops right from the womb itself.
Doctor, it's very nice how you explain it. But even if you look into the aspect of science, the heart is beating, the liver is functioning, the lungs are working on, carbon dioxide are exchanging, oxygens are coming in, red blood cells. It's a big, big, big science behind that. So the baby
Yes.
probably hearing a symphony kind of music with a nice
Yes.
musical orchestra at all times. That's why probably the moment the baby pops out, as a gynecologist receive it, he or she start to cry coming on the real world. But I think it's very cozy being inside the womb, especially with the mummy's love, with the care, the concern, and emotions. That's why they say whatever the mother thinks, the baby has always been connected. It's always been connected. It is true from her. So I think as a woman, the woman has some magical powers within herself, which of course no one else can do it. Not the male species, but only the female species. So for that, we are giving all the great appreciation to the woman out there.
Yes. Yes. I agree with you. Absolutely.
And doctor, I've also noticed, even we as adults, when we sleep, sometimes we sleep like this, sometimes we sleep like that, sometimes we are cozy. Is it a kind of a pattern? Because in that tight space, as all
Mm.
features from where we are right now. So I think there's some habits, because I do know some people actually sleep like this when they are in the bed. Is that like always being closed up like a cozy? So is it
Yes.
something, it is related, right? From the stage where it delivered from as adults. I think everybody need that kind of love, that kind of hugginess, right?
Yes. That's you actually hit the nail on the head. You know, if you look at a baby when you do an ultrasound scan, they lie in a curled up position, something like a ball. So whenever we feel insecure, we will curl our body into a ball, and automatically when you sleep, most of the times we don't sleep flat. We will be either on the left side or the right side, and we are curled up. Yes, absolutely right. Good observation.
Maybe is it because of that comfortness that we get from our mom, and we somehow or other, doesn't matter what age we go into, we are still
Yes.
mommy's boy or girl. But I think that
Yes.
kind of comfort that you actually get it. So you notice that the legs
Yes.
are curled up, and put
Yes.
a blanket and put a bolster. So I think that
Yes.
we are very comfortable in the womb. That's why we stay there for 9 months without any rent.
Yes. It's the feeling of safety. Basically, when you curl up and you're cozy, you feel so safe and so nice.
Thank you, doctor. Thank you for that. And thank you, viewers. I mean, constantly there's a lot of messages that's coming in. Thank you. Keep them coming up. Like I said, this is a great awareness session. When we talk about women's health or women topics, sometimes there's a bit of shyness. But like I said, with gynecologists here, there's nothing to be shy of. I think we should be creating this awareness and talk it out widely. And thank you so much. There's a lot of tagging that's going on. Please carry on. Doctor, I think you are definitely a famous, because we see a lot of your fans are tagging people, so it's becoming viral as well. So thank you for joining the Kopi events. Thank you, doctor. And for those who have any questions, please keep them coming up, because as we go on to the topics, we definitely want to take Q&A for 15 minutes at the end of the show. But in the meantime, please keep sharing and spreading out the love, because the topic is all about women's health. So, doctor, from the womb, we are now going into the real problem of the womanhood, right? We tend to see women not as a character, but I think in terms of, basically in terms of health, women tend to have a lot of issues because of their womb, and because of fibroids, or endometriosis. So many health issues, uh, pre and post as well, pre-pregnancy and post-pregnancy. But one of the things that is becoming very common, endometriosis and its
Yes.
treatment. So let's get started up with the condition first, then probably we go into the treatment. Probably some might not even want to go for the treatment. I mean, they might be worried. So let's talk about endometriosis, doctor.
Okay. Now, endometriosis, yes, it is one of the most common issue affecting a lady in the reproductive age group. That means when she's having menses. Now, what is this thing called endometriosis? Endometriosis, in Malay, they call it senggugut. Basically, it is the presence of the uterine lining outside the uterus, somewhere in the body. Most of the times, it will occur on the ovaries. It can also occur in the muscle of the uterus or on the surface of your tummy, the lining of your tummy. But I've seen a few cases where we have done appendicectomy, removed appendix, or we did a cesarean section, and 1 or 2 years later, they come back with a swelling on the scar. And this is actually endometriosis growing in the scar. And quote unquote international case reports, they have weird cases where the lady coughs out blood whenever she has her menses. This is
Mm.
because there's endometriosis in the lung. So those are very rare, but more commonly you have it in your uterus, in your tummy, or on your ovaries. Now, how do they present? Excruciating pain, absolutely painful menses, which gives you zero quality of life. So during their menstrual pain, they have absolutely no will to work. And some of my patients have even told me, I would like to take a knife if I can and cut it out because the pain is that bad. Okay, now, how can we diagnose? 40% of women will have endometriosis. It is very common. But up to 70% of these women do not know that they have it until you get the pain or you get that swelling in your tummy. Or you find that after getting married for so many years and you still can't have a child. So that is what we call fertility issue. So how do we diagnose? It's basically from your symptoms. Symptoms meaning you will come and you will tell me that my menses is extremely painful, is getting worse day by day, and there's a swelling in my tummy. Sometimes it is incidental, meaning when I do a gynecological examination on the lady, I will find that there is a blood cyst, what we call a chocolate cyst, blood cyst in the ovary or in the tummy. So this will cause a swelling feeling. It will also give pressure symptoms. How do we treat? We must always bear in mind that quality of life is very important. So during the treatment, I will usually go for medical treatment first, meaning to stop the pain, I will give you painkillers. If it doesn't work, I may need to give you hormones. And these hormones can be from the mild form of oral contraceptive pills, or it can go to hormonal pills to stop your menses. As long as you do not have menses, you do not suffer from endometriosis. No menses means no pain. So if you're not taking the tablet or it doesn't work, I may need to give you injections, hormonal injections. But the drawback or the side effect of this injection is that I will be creating artificial menopause in you for the duration of the injection. And artificial menopause is not a very nice feeling. It gives you hot flushes, you sweat, you become cranky, and you sort of grow old during the few months when I give you those injections. Now, if you recover, well and good. If you do not recover, you may actually need to do surgery. And what surgery are we going to do? There are two types of surgery. One is conservative surgery, meaning I go in, I remove the endometriosis problem. If it's a cyst, I remove the cyst. If there are small dots on your tummy, I will just burn those dots. But if it is so severe, or if you have completed your family and you do not need your womb and your ovaries anymore, I may need to remove them.
Doctor, just to pause here for a while.
Yep.
When it comes to womb removable, that's our next question itself that we will be going in. But some women do feel that removing the womb, it's a big thing in their life, especially as a woman would, and they have a lot of thoughts in their mind. It's a symbol of who she is to the
Yes.
whole productive system in herself. But what kind of mental state that a woman may go through? Even one is for health, but another one is also being a woman. She wants to have that for the rest of her life, but it's a tough decision for a woman to make that.
Yes. Okay. Now, you are absolutely right. But then, if we look at the woman who is suffering from severe endometriosis, she will be having discomfort or even mild pain a few days or up to a week before her menses. And during her menses, she just cannot work. She just cannot function. She will curl up in bed and she will cry and she will do anything to stop the pain, but the pain will not stop. So, quality of life will be that bad. So, when it comes to that, discuss with the patient. Most of the patients will say, I would rather have quality of life rather than to live with this pain. So in such circumstance, we may need to remove the womb and the ovaries. But you are right, because every woman would like to live and die with the womb inside. I have got women who come, like I quoted just now, they just say, doctor, take out my womb. That's it. I can't live anymore.
So it's a big decision, especially
Yes.
it's not an easy decision because
Yes.
in my walk of life, I'm in the fitness aspect, so I do see these type of cases coming in, and the kind of symptoms and signs they go through, it's very unbearable, which I believe so. And of course, the person who's going through, like what you said, they feel so painful that they can go in tears and so on and so forth. But you talked about the treatments, and then we talk about endometriosis, but also it comes together with a package somehow or other. After pregnancy, the high chances of getting fibroids, and
Yes.
that the chances are there. But of course, pre fibroids, I mean, for pre-pregnancy, they also might have it, and because of certain gynecologists, yourself expert, probably you want to touch base on that. They're monitoring the situation, whether the centimeters is growing, or whether it's filling it up, or is it touching on certain other areas or sensitive areas. What is your take on these fibroids, and why these fibroids develop? Why is there a specific reason why it only happens after pregnancy or before pregnancy?
Okay. Now, fibroids, right? This is again another common thing that happens to women. It is also around 40% of the women will get this problem. There are many types of fibroids. You have got fibroids that grow into the uterus. You have got fibroids that grow outwards from the uterus, and you have got fibroids that grow inside the cavity of the uterus. So basically, what causes it? Number one is family history. If you have got family history of fibroids, chances are you may get a fibroid yourself. Number two is, of course, older women and women who have children. Basically, when you have children, your hormones shoot up. So these hormones are like fertilizers for the fibroids. So when the hormones grow up, these fibroids also grow. There is a saying among the obstetricians, a uterus that's not satisfied with a pregnancy will satisfy itself by conceiving a fibroid. That means you
Mm.
will see this in single ladies, you will see this in older ladies. Okay. And the other thing which is happening now very commonly is obesity among the female population. And we know that in obesity, the fatty tissue in our body actually stores a lot of estrogen, which is a female hormone. Now, it is this estrogen that's the fertilizer for the growth of the fibroids as well as the endometriosis. That's why it's on the rise.
Thank you,
So,
doctor. Thank you for the explanation on the fibroids. But certain gynecologists also say that, okay, we will monitor the situation, come back
Mhm.
in another quarter, 3 months later, and then we're going to measure the centimeters. So if these centimeters just keep on increasing, then it's a sign of removal,
Okay.
operation.
Yes. So there are a few scenarios where you need to remove the fibroid, or you may even need to remove the uterus. Number one is when the fibroid grows very big and it is having pressure effect, meaning it is compressing on your bowel, it is compressing on your, the ureters, which are the what you call the tubes connecting your kidney to the bladder. So it will compress, and the urine cannot flow from the kidney to the bladder. So your kidneys will swell up. You get hydroureter, which is swelling of those tubes. Of course, it can cause pain. And if there's a rapid increase in size, always bear in mind anything that grows very quickly in a human body can be cancer. So in such circumstances, we may need to remove the fibroid, or we may even go in and remove the uterus. But of course, fertility. If the lady is still keen for fertility, we will try our best to do conservative surgery, go in, remove the fibroid, and come back out without taking out the uterus.
So you seems to be the like a man in black, or on a project where you have to go and make a decision, precise decision. So it's a lot of calculation, it's a lot of reads, it's a lot of care, it's a lot of concern. I mean, what can I say? You are in that situation. You got to make that decision together with the family, especially with the loved ones, to get the best care and concern for them. So I appreciate, doctor. I appreciate that a lot.
Mhm.
What I'm going to do right now is I'm going to bring up another guest speaker, Dr. Arvinda, who is our guest speaker as well, to see what kind of cases that he have faced and how he actually refers to gynecologists or even to a certain specialist. So let's get Dr. Arvinda up. Hello, Dr. Arvinda.
Hi everyone. Hi Dr. Tham. Hi Vince. How are you guys?
Hi.
So, Dr. Arvinda, we are in a state of gear 2 to gear 3. We are picking up the speed, and together with Dr. Tham, whose explanation is such a wonderful and a blessing, and a lot of viewers are also starting to ask a lot of questions. So, Dr. Arvinda, I mean, you also do see a lot of patients, but how is this patent relay? Like was talking to Dr. Tham, after from a fetus all the way up to popping up the baby, Dr. Tham is in fully in charge. And after which he has to hand over the baton to someone. So that's where the pediatrician comes in and so forth. But for yourself, if a woman comes to you and say that they have a pain and sign and symptom, how is this process works? What do you actually do?
Right. Hi everyone. Good evening. My name is Dr. Arvinda. I'm having a master's in clinical research, and I do a lot of primary care work. Currently, for this COVID-19, I work and I'm set up in a primary care. So, Vince, the question was basically what do we do when a patient comes in, right?
Yeah.
So, most of the time, what do we see a lot in primary care? We get a lot of ladies who come in with very severe period issues or menstruational issues. So, one of the main issues they come is with severe pain. Some of them get it monthly, some of them get it 2 or 3 monthly, some of them get it quarterly, half yearly, some get it once a year. I'm talking about painful menstruation. Some of them come with heavy bleeding, and most of the time when we see these patients, it is very very common, and it's actually how Dr. Tham put it. By the way, Dr. Tham was my houseman boss, and I still call him boss until today. So one of the things I learned from Dr. Tham is never take every case lightly. When a patient comes, you examine the patient thoroughly. You make sure that the patient is comfortable. Ask what are the issues, and Dr. Tham actually mentioned one of the very few important things just now, or the many things he was saying, is most of them, it's not the period that is actually causing the problem. They can't function. That is what that bothers them. They have pain. Some of them may be able to tolerate the pain, but because they are not feeling as well as what they should be, what happens is their function becomes less, and it may affect their working life, it may affect their social life, it may affect their family life. And so sometimes you have to look at it holistically. So I think to answer your question, man, most of the time when the patient comes in is, of course, we would like to treat what the patient is having. You would like to treat the patient with symptoms, exactly how Dr. Tham put it. You may want to give some painkillers of that sort, but at the same time, you never want to neglect the social and mental issues, mental health issues, to be more specific of what the patient may be having. And you see a lot of them who come. I have seen, and Dr. Tham can correct me if I'm wrong. I see some patients nowadays who come with anxiety because they know that they're going to have their menses soon and they're going to start bleeding badly or they're going to have pain. And these patients, they come in anxious, and it may be related hormonal, it may be hormonally related, or it may just be of that sort. But we are seeing quite a number of especially younger children who are in their adolescence who are coming in and they're going to say, I'm going to get my period, and they're anxious because last month may have hurt very badly. But when they come, when the period comes up that month, they say, I'm okay. This month I'm okay. So the anxiety keeps coming on and off, and especially those people who have irregular periods or their periods are having some disorder. That is what we normally see in primary care.
All right, Dr. Arvinda, thank you for that, for how you actually passed the baton. So now we are going back to Dr. Tham again. So Dr. Tham, we talk about fibroids, and as women, they after pregnancy, especially, they tend to face a lot of other issues as well, like what Dr. Arvinda said: stress, anxiety, irregular. We will come back to the irregular menstrual on the later part of that. Now we are moving off to the gear 4. Doctor, of course, we talked about endometriosis and we also look at fibroids. Now we are going into the main issue that we talked about, where actually a woman have to decide, and of course together with a gynecologist, and how this process is going to work, whether it's yes or is it a no. Emotionally they might feel it even post surgery. How will be their mindset versus the body? Will there be any other changes if they go through the womb removable?
Yeah. Vance, to remove the uterus is a big thing, as you mentioned. So psychologically, it will affect them. They will feel like I have lost part of my body. Now, this is especially important to the Muslim people because Muslims like to be buried whole in the sense everything is complete. So they are actually the ones who would love not to remove the uterus. However, sometimes you need to remove it, especially in cases such as surgery. So they need a lot of counseling. You need to get the family in, talk to them, tell the husband. The women are actually absolutely fearful of being a lesser woman or less of a woman once you remove the uterus. In fact, my auntie was one particular case. She had some problem with the uterus. She needs to get it removed. A week before the removal, she got very worried. She called me up. She said, after I remove my uterus, will I still be a woman? I said, of course. Will I still be a wife? You know what I'm getting at, right? I say, yeah, sure. We are removing the uterus. We are not touching the vagina. You still function as a lady. So, very important, counsel them as a couple. Get the husband in and talk to them, because there are a lot of issues which the husband does not know. The wife may know, but men being men, we will say, yeah, what you know. Let the doctor talk. So I believe that combined counseling is the best. Yeah, they have a lot to go through.
Thank you, Doctor. I mean, it is a big thing. And like I said, as we are moving on, we are coming into the next stage. We also have lots of questions that's coming lined up for us. So probably we will take it that we are almost in 34 minutes of our live chat. So, Doctor, so we talked about the symptoms. We talked about the starting, how a baby will be in the womb. We talk about that. We talk about the signs and symptoms of issues with fibroids, endometriosis, and other womb removal as well. But there's also another big issues, all right, which is, of course, we talked about earlier, which is irregular menses. There are some cases where a woman does not even get menstrual cycles in a period of a year or sometimes 8 months, and big issues that also involves endocrinologists because hormones are hijacked, and here the menses are not coming in. So there's a big changes. They cause a lot of bloatness, a lot of mood swings. They call it the pre-menstrual syndromes and that kind of stuff. It's easy to say, but as a woman, only a woman understands what she's going through. But And when we talk about the reproductive system, we talk about that home, we talk about all the other symptoms. Why is that it's not always been as easy as 1, 2, 3, but why there's always complications? Some would get it, some doesn't get it, some got more than 14 days, more than 15 days. So there's a lot of issues here. So how do you actually look at this, and why is that a lot of varieties in these issues?
Okay, now this you're touching on a topic that has so many ramifications, so many things attached to it. Okay, basically, to get a normal cycle, you need the brain to function normally, to produce the hormones which will control the ovaries to produce another set of hormones that will order the uterus to have the menses and also stops the menses. So basically, that is what we call the brain, the ovary, the womb complex. It's a triad. Okay, anything that disturbs it will give rise to menstrual problems. So basically, you can divide menstrual issues into two parts. The first part is what I would like to say, it's physiological. Now, being an L licensed driver, you drive very erratically. So also, when you're approaching 60, 70, again, you drive erratically, right? So what it means is that when you have your puberty, you're starting to have your menses, your hormones are not so smooth because you are a brand new engine, brand new driver. Also, when you're near menopause, again, your ovaries are not functioning properly. Your hormones again goes haywire. So during these two times, beginning of your menstrual period, menstrual era, and the end of your menstrual era, you will have irregular menses. So that's physiological. The other thing is, if you are breastfeeding, when you breastfeed, your menses usually do not come for the first 3 to 4 months if you do exclusive breastfeeding. And after that, your menses will be very irregular because of a hormone coming out from the brain which produces the milk. So this hormone disturbs your menses. Now, then we go into pathological diseases that cause irregular menses. First and foremost is polycystic ovarian syndrome, whereby there is a disorder or imbalance in your female hormones. Usually these women are of bigger size, they are a little bit more hairy, and they have acne, and the menses will be irregular. The reason being their male hormone is quite high.
And that's will be a testosterone, doctor?
Yes, the testosterone is higher. The second reason is if you have got endocrine disorder, that means there's hormonal imbalance in your body, especially when you talk about your thyroid hormone. Thyroid is a gland in your neck. So when you have too much of thyroxine, too much of thyroid hormone, or too little, again, it will disturb your menstrual cycle. Now, next, you have got your fibroids and your endometriosis, which will increase the surface area of your womb because your womb is enlarged. So when you have larger surface area, you have larger area to bleed. And when they bleed, they do not bleed the whole piece coming out. It may come out in patches. So you will get menses, stop a few days, menses again, stop a few days, and menses again. And last but not least, beware if you have irregular menses, it can be because of cancer. It can be cancer of the cervix, cancer of the ovary producing irregular hormones, or cancer of the womb itself.
Thank you, doctor. Thank you for that. I know it's a big issue that always gynecologists also look at. There's a endocrinologist is involved. We have to look at the hormones. We've got to do blood tests. It's a big thing. It's a big science. It's going on. From here, we are also moving on to the next topic, which I'm going to pose it to Dr. Arvinda. Dr. Arvinda, like I said, the whole world, right? There's some low birth rate is a problem. Why do you think? Is it because due to stress, because of not spending enough time, families, husband is working in the day, wife is working in the night shift, day shift? Is it the problem, or is it because everybody is stressed, or because of our food? I know this COVID also has created a big mess. But in your expertise, as you know, you have done a lot of studies and you're full of statistics. What actually this this problem is all about?
So I think Dr. Tham will be able to answer that better, but I'll just share with you what I roughly know. Low birth weight, Dr. Tham always used to ask me when I was houseman, Arinda, the low birth weight, the patient has come in at 34 weeks, low birth weight. What is the first thing you have to say? And he always told me, you don't mention this, I'll fail you wherever you are. The first thing is wrong dates. Most of the time that they come in, they may not be at the exact date which they are because of irregular periods. That is why we actually think it is a low birth weight child or fetus which we are having. Unfortunately, the mother has got the dates wrong due to whatever reasons. So that is number one. Number two is it could be due to anything. It could be the conditions which the mother is in. The mother may be a very severe hypertensive patient, or the mother may be a diabetic. Diabetic, you can have a very big child, which they call it macrosomia, or they can be a child with growth restrictions. Number three is maybe uterus. It may be due to the way the ultrasound scan is done, which is from an inexperienced person. You get someone like Dr. Tham to scan, you will get a very, very good and accurate scan. The other thing is it could be also now infective in nature, because one of the things which we actually look at is Zika. Sometimes they actually have anencephaly, where they actually don't have a head brain development when they start. That is also one of the causes of a small or inappropriate growth of the child. Or it could be any infective issues in nature. Most of the time in primary care, at least, when we find that these are the issues and we can't identify what is the source, we send the patients to professionals and specialists like Dr. Tham to actually look and go into details with that. So it can be due to anything, but most of the time, I think the biggest challenge here is to identify the cause. I think even with the mother's hypertension going up and down, sometimes it affects. Well, statistically, that is how it is. But I believe Dr. Tham will have a better and more simplified answer than mine.
Thank you. I'm going to bring it back to Dr. Tham again. Dr. Tham, I mean, of course, we know the birth rate is low, but also it's related to this question that set up is, why not getting pregnant even though the cycles are clear, the cycles are smooth. There's also be other factors. Maybe not fertility, not enough, or is that some issues with the hormones? What is your take, doctor?
Okay. Now, this is an issue which happens every day, even with my patients. You can say that she is ovulating, but then to have the baby, there's so many factors that can contribute to not having the baby. Number one is the egg good enough? Meaning the quality of the egg. We do not know. What is the quality of the egg that is coming out? And number two, if the egg is coming out, are you having sex frequent enough? Because a male sperm can only last in the female body for 2 to 3 days. So if the egg comes out on the wrong day and you are not having sex, the egg has got no boyfriend to play with. Okay? And then the third thing, if you are married, you are having regular sex and you are sure you're ovulating, you don't know the quality of the seminal fluid coming from your husband. He is shooting out tremendous amount of water, but does it contain any fish inside? Does it contain any sperm? You don't know. And the fourth, you say you're ovulating, you say you are having regular sex, you say his sperm is super powerful, but are your fallopian tubes blocked? You don't know. So there are so many things that can cause a lady not to get pregnant, although she is ovulating. Can I just add something to the question which Dr.
Please,
Arvind
doctor.
answered just now? The
Low birth
low
rate.
birth rate. Yes, the low birth rate is happening worldwide. And there are many studies to prove that the man's sperm is actually decreasing in quality and also in quantity, meaning the concentration is dropping and the quality is dropping. And women are also having this issue. Basically, it is because we are delaying pregnancy. We are getting older before we want to start a family. We want to work first, earn first, then get married and start a family. But also bring in other things such as our lifestyle is terrible. I have got orang asli coming in asking me to help them to get pregnant. And we know orang asli are the people who have 20 children at home. So basically, it's the food we eat. We are eating all non-organic. We don't know what we are eating now. We don't know what we are drinking now. We don't know what we are breathing now. So that contributes to the low birth rate.
Well said, doctor.
Sorry,
I just
one
add
more
on
thing.
to that. Yeah, doctor.
Sorry, I heard it as low birth weight. I didn't know it was low
Yeah,
birth rate.
yeah.
So Dr. Tham also mentioned about orang asli, and I think Dr. Tham will remember, when we were working together, we used to deliver, I think orang aslis who came in with their first or second child at the age of 14 and 15. And I'm
Yes.
sure Dr. Tham is still seeing that because Dr. Tham always happens to be around when this happens. But yeah, if a orang asli, I agree. If a orang asli comes in and they can't get pregnant, something is absolutely wrong.
Yeah.
You know, doctors, is that could be a reason because we know that our human body is full of cells, full of function systems. Since the systems are just hitting on heart is beating, liver is working, kidney is working, pancreas, endocrine system, the blood cells. There's so much of things happening in the body. But do you think also because of why we talked about the sperm not much of infertility or even for the woman, is it because lack of exercises? I like to bring physical fitness into this aspect as one part of a holistic. Do you think that possibility for male to increase up the testosterone, they have to do some weight training, because we all know that the more muscle mass you have, the higher the chances of your activity level is. You increase up your hormone level time to time. You don't let them go in a very monotonous stages. But do you think exercise plays a part in this aspect?
Yes, you are absolutely right. As a person who is very active, you will have more stamina. Now remember, having sex is a form of exercise. So if you have better stamina, you will perform sex better. And they have done a few studies that showed that there is a significant rise in testosterone level, male hormone level, to people who go to the gym and do squats. You build your quads, you get more testosterone. So that's why if you look at men, they always say the bald man is very virile. But
Yeah.
also, yeah, the guys with big legs, beware of them.
Okay. After this talk, all the males will be working out on their legs, because Dr. Tham and Banan and Dr. Arinda said, "Work the legs, come on." And it's true. I mean, when you don't use it, you lose it. And our muscle mass are nothing firm or concrete. The moment you stop exercising, you tend to say weight reduction. But that one shouldn't be happy. Hey, I lost 5 kg. Yes, you lost 5 kg. But what do you lose? You lost water, you lose calories, you lose fat, you lose muscle mass. So losing muscle mass is also another part of very important part. But doctor, what you said very true. While having sexual relationship or during that period of time, heart rate goes up. You have to active your muscles. So that's important. For a couple who are planning for future. I think this is all very important aspect which they have to do it. I'm going to go on to the next question, doctor, which is, this is also another concern because they are worried about the genetic abnormalities, the age factors, because of, future planning. You want to get a credit card, you want to get a condo, you got to get a car, you got to get a career. We call it the 4C or the 5C. Now, probably about 10C right now. So, cash as well. Is there any age, doctor, and why is that so? We do often hear, very often, that age 40 and above, it's a high risk. Maybe shall we touch on this topic?
Yes. Okay. Now I will answer this question backwards. At what age is it unsafe to have a baby? First of all, I would like to say at no age should we deny a woman the right to have a child, because some of them, especially nowadays, they get married at a later age. So they would love to have a child before they have menopause. So at any age, it is okay to have a child. But now the gist of this question. Above 35, there is an increased risk of genetic disorder or genetic abnormalities in the fetus. And of course, with each increasing year, the risk increases. For example, I will give you Down syndrome, the one we fear most and the one we know most. At the age of 35, the chance of a lady having a Down syndrome baby is 1 out of 250.
That's not very far.
Yes. When you go to the age of about 38, it's about 1 in 150. When you reach 40, it's about 1 in 80. If you cross 42, it's about 1 in 50. You go to 43, 44, it's 1 in 30. So it drastically increases. So basically, try and complete your family by the age of 35 or as young as possible. Of course, mind you, spacing of 2 years. Deliver a child. When that child is 1 year old, start your next pregnancy. So that will give you a completion of 2 to 3 babies in a matter of about 5 years. 4 to 5 years, you have completed your family. If you want it bigger, you got to start earlier. And
So this is indeed a planning, so future planning.
yes. And if you were to get pregnant at a later age, you should always do screening for abnormalities. As early as 11 to 13 weeks, you can do a simple first trimester screening, which is scan the baby and look for the thickness of the skin behind the neck of the baby, plus blood test for the mother. That will tell you the risk for 3 types of trisomy, which is Down syndrome, Edwards syndrome, and Patau syndrome. And now they have got another one, very accurate. Right from 11 weeks onwards, you can check. You actually check the genetic makeup of the fetus, the chromosomes. It is called NIPT, non-invasive pregnancy testing or chromosome checking. So it will check every single chromosome in the fetus. It is up to 98% accurate.
So indeed, doctor. So I think it's a full of planning, stages
Yes.
where we talked about. Dr. Arvinda, do we have also cases where couples comes to for consultation and or is it couples nowadays they know what to do exactly, right? They get married and start to have kids, or do you see these type of cases as well, Dr. Arvinda?
Yeah, we get a lot of patients who come in for counseling. I think we tend to refer those patients who unable to have children for more than 2 years to good professionals like Dr. Tham for fertility treatment. Sometimes, like Dr. Tham says, it's a big story, but I mean it's a story with many type of endings. You have happy endings. Sometimes, unfortunately, you have unhappy endings. But I know that a lot of people who go to Dr. Tham have many happy endings. I have seen with my own eyes. I was directly involved with Dr. Tham and his clinic, and I've seen many people who were infertile for many years who have been given the blessings, of having a child. Sometimes even more. I've seen that Dr. Tham delivered triplets, right, Dr. Tham, if I'm not mistaken. The first
Yeah.
triplets in Perak was delivered by you. And so I think there is multimodal, but a lot of patients who come in ask the same questions which you are asking, Vance. Number one is, which Dr. Tham has covered, if I marry late, what will happen? And it's getting more and more frequent. You know why? Everybody is putting their careers, everything in front of them, and they're delaying marriage, and of course delaying delaying having children. Some of them are married very early, but they still delay in having children because they want to focus on career first. So you mentioned all the 5 C's, but unfortunately now we have a 6th C to deal with, which is COVID-19. We don't even know. We don't even know whether COVID-19 will affect any sort of long-term. But these are the type of things that become, even patients who are coming out and saying now, I've got COVID-19. Well, I've just recovered from COVID-19. So there are a lot of new things which are changing, but unfortunately, some of them we can actually tackle and some we don't. But the most common thing which we see is those people who come later stages of life, planned or unplanned pregnancies. That is also quite common. And most of the time, unfortunately, a lot of them blame the ladies for not being able to bear a child. But when we investigate, we actually find out that the man is the one who is having an issue, who not having enough adequate sperm count. And so it's quite tough. But fortunately, in Ipoh, we have good people like Dr. Tham, who has helped many people. So yeah, we do see a lot of patients who are coming in, but for different reasons. Some for worried for not being able to have a child. Some have a different problem. They have too many children, and sometimes they have so many unplanned pregnancies. I've got one one lady who came in the other day for the fourth unplanned pregnancy, and she's already having about 7 kids at home. So yeah. So these are some of the different things which we actually see in primary care.
Thank you, Dr. Armida. Thank you for that. On your ground level, I mean, of course, it's very important that we also need to know what exactly is happening with your expertise. And so now we add one more C inside is the COVID, also playing a very tremendous part. He is the most difficult part. But looks like we have to go and take some questions already, because lots of questions just pile up, and constantly we
Sorry,
are.
Vince. One more thing can I just say
Yeah.
about COVID?
Yes,
When
please.
the lockdown happened, I don't know. I'm very sure Dr. Tham will tell you. In the last few months, we are actually getting more and more patients who are pregnant. And
Yeah.
when you look back in time, it was during the lockdown. Because
Yes.
people were all kept confined, and I think the fertility rate just shot up then, and that is something which we have to look at perhaps in the future, maybe next year when we actually, or maybe this year when we compare the non lockdown periods with the lockdown periods. Has the fertility rate gone up? I'm quite sure we'll learn something from that.
So thanks for COVID for only for this part. We never hear people saying thanks, but only for this part, getting couples together and spending more time, and we are doing something very productive. Okay, looks like we got to take a question. So doctor, uh, don't want you to answer this question yet, because we have a lot of questions relating to PCOS. So we have a viewer that I'm actually seeing right here. I was diagnosed with procrustic ovary syndrome, PCOS. Told me I had 13 small cysts, but after 6 months it was cleared. What happened? How did it disappear? Will there be reoccurrence? So it came and disappeared. All the 13 small cysts.
Okay, basically, PCOS, polycystic ovarian syndrome, you're born with it. It's what your mother gave to you. It will present itself if you do not take care of your health, meaning you have to remain slim, you have to exercise. Then the PCOS will not manifest. PCOS will never disappear, but it will regress, it will hide, it will slow down. So usually if you do not take care of your health, you don't exercise, you put on weight, then you will find that the ovaries start producing all these small little cysts, which are basically small baby eggs that cannot grow and cannot ovulate, cannot come out. So this causes a rise in male hormones. So I think what happened to this particular lady is she took exercise and she controlled her diet. So her lifestyle became better and the symptoms of PCOS regressed and she became her normal self again.
All right, so let's ask her. So, if you have done any changes on your diet, if you have done any exercises, on a very consistent basis, but in the same. Oh yes, she has replied yes, yes. So doctor is on spot. Our gynecologist is on spot, which is of course food and exercise plays a very important part in this matter. Okay, doctor. So now we are taking up the longest question right now, which is over here. So, Dr. Tham, can you please share your knowledge on
Mittel
Mittelschmerz?
Schmerz.
I
Okay.
have been overeating food this is a big thing which causes pain unbearable. At my last consultation, I was advised against hormone therapy due to my age, the risk, rental. All I've been asked is to take painkillers before and during ovulation. Most time, even painkillers don't work, don't even morphine. So I think this is the most serious thing right now. Doctor, your take, please.
Okay. Now, Mittelschmerz. Mittelschmerz is actually a German word. It means mid-cycle pain. So any lady with Mittelschmerz or mid-cycle pain actually is having ovulation. That means she's producing the egg. And it's because the egg is rupturing and coming out from that follicle, she gets that pain for 24 hours. So you cannot do anything about it. You are just ovulating. So I read down there that she cannot take painkillers, she cannot take hormones. So there's nothing much you can do. But there's one particular form of therapy that you can try. If she is not keen to get pregnant or she has completed her family, she can use hormonal implants, meaning there is an implant which you put in your arm to prevent pregnancy. So it stops ovulation. So when you don't have ovulation, you don't have Mittelschmerz.
Doctor, is that a device called I something, right? It's a
Yes,
device.
Implanon.
There you go.
Implanon, yes. She can try that. But it's
Okay.
a hormone also. It's still a hormone, although it's a much safer hormone.
Thank you, doctor. Thank you for that. Hope we have answered that particular question itself. So yes, another one more. Also tend to be a very long paragraph. So, but we will take it. So she has first and second pregnancy, got hypertension. Okay, in the second trimester for the pregnancy, the first baby born was 38 weeks, and second baby was born in 34 weeks. It's more likely because of the hypertension that I have to deliver early. So that was a syndrome. That was a sign. So our blood pressure, but she never mentioned whether it's stage one, stage two, or stage three of blood pressure. So we don't have the readings. But on the second pregnancy, doctor said I got pre-eclampsia.
Pre-eclampsia, yes.
Yeah, and doctor asked me to planning for the next pregnancy at least 3 years after the second and the C-section. How to avoid hypertension during pregnancy? So she is facing that.
Okay. So how to avoid hypertension in pregnancy? Basically, the answer is, but I've got a second part to it. Basically, the answer is there's no way you can prevent it because genetically you have hypertension. In your body, in your genetic makeup, hypertension is already present. So when you are pregnant, your body is weakened. So when your body is weakened, the hypertension will show itself because your engine is running very hard, running for two lives. You're running two engines. So it cannot prevent the hypertension from coming out. So when she gets pregnant the third time, the hypertension is going to come in much earlier and is much more severe. But in order to control the hypertension, her question should be, how do I control the hypertension so that I do not end up in the same way? So basically, pre-pregnancy counseling. You need to attend the pre-pregnancy counseling where you need a healthy lifestyle. Again, back to what we do. We are what we eat. We are what we do. Eat healthy, stay healthy, and your hypertension will be very well maintained in the beginning of your pregnancy. So that will give a good start to your pregnancy and maintain this good health throughout. And of course, with your history like this, we usually will prescribe aspirin. Aspirin is an anticoagulant. So what it does is it makes the blood a little bit thinner. So the blood can travel a little bit better in the blood vessel. So the hypertension will be much less. Basically, the baby tells the mother, "Mommy, I'm not getting enough blood." It's because the blood vessels are very tight. The pressure is very high. So the baby tells the mother, "Mommy, give me more oxygen, give me more food." And the mommy says, "Okay, I'll give you more." But how does she do it? She increases the pressure because trying to push more fluid through the blood vessel. And this makes the blood vessel even thinner, even tighter. So the baby will say, "Mommy, I said more, not less." So it's a vicious cycle. So if you give aspirin early in life, early in pregnancy, when the blood is a little bit thinner, it flows a little bit better, the baby will not tell the mother, "Mommy, give me more oxygen, give me more blood." So the substances that is produced by the placenta will be much less. So the hypertension will be much less during the pregnancy.
Doctor, talking about blood pressure during pregnancy, some of them might be, some doctors, of course, because to control the blood pressure, they might given certain like beta blockers and so on and so
Mhm.
forth. But is it safe during pregnancy for women to take beta blockers? While through the pregnancy?
Okay, beta blockers can be given, but not in the first trimester, because it may cause some issues with the developing fetus. So basically, you can give, but not in the first trimester. The safest is to give a medication we call alpha-methyl dopa that has been used for donkey ages and is proven to be very safe.
Thank you, Doctor. Thank you for that. Dr. Tham, we have only one more questions, and more questions are coming in. So Dr. Arvinda is going to take it later. That is related to more on family issues, stress, anxiety, and so on and so forth. But Doctor, we have one more questions for you. I know you have spent quite a long time with us already, 1 hour and 6 minutes. I promise to be 1 hour, but it comes to almost the last thing that we are talking about, the baby development stages.
Okay.
Before you pass the baton, Arina see a case and he says, okay, this case have to be referred to the gynecologist. So he refers you to a gynecologist, and gynecologist you taking over, and then you go through the your procedures and kind of stuff. And then once the baby pop out, okay, and then you say, okay, now my this period of coverage is done. I'm passing it to the pediatrician. So during the baby development stages, before or during the pregnancy, is there something that you always look out for? How's the baby condition? Is he kicking hard or is he moving? What is his heartbeat? And we what is the heartbeat of a fetus,
Yes.
and so on and so forth. Is there something that you do?
Yes. What we usually do is, number one, we must always measure the height of the uterus of the womb as it grows. So it must be always corresponding to your period of pregnancy. So anything bigger or smaller, then we need to investigate. So how do we investigate? We will do an ultrasound scan. So what do we do during an ultrasound scan? We will look at the baby, we will measure the head, the tummy, and the thigh bone. So this will tell us generally how is the growth of the baby, whether it is growing according to plan or is it getting too big or too small. Next, we look at the amount of amniotic fluid, which is the water surrounding the baby. So the normal amount of water should be adequate, which is around 5 to 20. We say it as 5 to 20. Anything less is too little, and this is detrimental to the health of the fetus when the fetus comes out, especially lung development. Anything more, then the baby might have the issue of premature delivery where the womb is too big, so the baby comes out earlier. And next, we look at the structure in the baby, meaning we look at the brain to see whether the brain is dilated or not, the ventricles in the brain are dilated or not. We look at the eyeballs, we do a detailed scan. We look at the lips to look for cleft lip. We look at the stomach to see whether the throat is functioning. We look at the heart to see whether it's a normal heart. We look at the diaphragm to see whether there's any hernia, and the whole works. The fingers, the toes. Next, we look at the placenta to see whether the placenta is low down or not. If it is low down, it will block the exit, and you have to be delivered through a window, lompat tingkap, which is a cesarean section. So there are a lot of things that we need to look at.
Doctor, at this point of time, I got to mention this. Probably Dr. Arvinda also will agree. You seems to be an investigation officer
Yeah.
rather than a gynecologist, because you see, doctor, you have to look at so many symptoms, signs. You got to look at the mother's health, the anxiety. She might feel anxious. First time she's panicking. But looks like, wow, it's a big procedure there, and I think that comes with great experience and going through that. So I think that is your expertise, like investigation officer.
NCIS.
Yeah. Uh, Thank you, Doctor. I mean, it was a very
Thank you.
fruitful 1 hour, 10 minutes with lots of questions, a lot of viewers. So I'm sure you have a great fan base. People are just following you, so which is great. And it is a great pleasure to have you in Kopi Events and sharing all about women's health. And we talked about a lot of situations, what they can do, and your wise words. Thank you, Doctor. Thank you very much for joining at Kopi Events.
Thank you, Vance, for inviting me, and thank you, Dr. Arvinda.
Oh, Dr. Tham, thank you. Most
Okay,
welcome. Thank you, Dr. Tham.
Doctor, before
thank
we
you.
say goodbye to you, and probably we'll get connected again, any wise words for women out there?
If you have an issue, please don't hesitate to look for your friendly neighborhood gynecologist.
Thank you, Doctor. Thank you so
Okay,
much. We will stay in
thank you.
contact and we'll stay in
Sure,
connection. Thank you so much, now.
sure. Thank you.
Thank you, Doctor. Pleasant
Sure.
evening. Thank you. Bye bye.
Bye.
All right, Dr. Arvinda, we have come to the last part of the show. It was a great pleasure to have Dr. Tham speaking in the topic of women's health, but also like what Dr. Tham has mentioned, and you also have mentioned it. The anxiety, the depression, and during that period of time during a pregnancy, going through 3 trimesters, right? It's not just one day, 2 days. It's going through 9 months. A lot of changes happening to them, right? The beauty might be changing, the stretch marks becoming, and they're going through a big issues because they might think they're not attractive. So many things, it's a big drama that's happening in the brain. But the woman is still strong and going ahead for the 3rd trimester to deliver the baby. But what is the bigger part that is taking over in the brain? Because now we are talking about the anxiety part and the anxiety part, anxious and anxiety. What do you think? What will happen?
I always feel this lah. When a lady is pregnant, right, she puts her body through a lot of stress. I would say physical and mental stress, both. She's dealing with another newly formed human being inside her. um, you know um, and a lot of things which I see in primary care is ladies who are pregnant coming in with outbursts of anxiety, outbursts of being upset. The other thing is which we see is they always get cramps. What cramps? Leg calf cramps. And a lot of them come and tell me, hey doc, when I was not pregnant, whenever I get my period, I get abdominal cramps. Now I am pregnant, I get leg cramps. You know why? Because when the fetus is actually starting to form its bones, the fetus is starting to form bones, it utilizes calcium. And where does it get the calcium from? The mother. So when you have calcium deficiency, you get cramps, right? Especially after a long run and all that. Unfortunately, these are few things which we see. And as we go along throughout the years, we actually find more and more things which are actually quite related. A lot of them come with mental stress. I don't know, there is no medical answer for this. My personal experience, I wish Dr. Tham was here, he could have mentioned. Normally when the and this is from my observation, there's no scientific evidence to this. Normally when the child is of a different sex, the mother um, and if even if the mother doesn't know, the attitude may be a bit different when the child is the same sex. All right. A lot of people start predicting the child's gender from that, but I have noticed that when it is the same sex, they act differently. Even when they don't know about it, they don't know what the child's sex is. The symptoms are different. A lot of them tend to have more nausea when there is one sex, and some of them they have outbursts of anger and all that when it's the other sex. But this is just from crude observation. But the other anxiety we always see, which lasts for a very, very long time, is a mother who is becoming the mother for a first time. She wants to care, she wants to show that she is a lady and at the same time a mother. It's not an easy thing. And she wants to care for her child even when the child is in the womb. And that leads to great anxiety at times. I've seen, you know, I've seen parents coming in when the child has very little symptoms, um, maybe accidentally coughing while drinking milk. They immediately rush, and you can almost tell that these are first-time parents. So most of the time when you ask them, and this is all due to anxiety when mental health is concerned. It's not a bad thing. I'm not saying that it's a bad thing. I always tell the parents that what you have done is right. Even when you come in, sometimes some first-time mothers, they come in, doc, my child has not moved in the last 3 hours. But they don't realize that the child has no sense of time yet. They don't know when it's time to sleep, when is the time to awake. So it creates anxiety in the mother. And sometimes when the mother's heart rate goes up, the child's heart rate follows, that sort of thing. So sometimes we end up doing an ultrasound scan and the child is absolutely fine, but the child is just sleeping. Heart rate is there within normal range, but so these are the sort of things that happen during pregnancy, and it affects people mentally. Unfortunately, I've seen a mother who the dates are very near, and she keeps getting anxious that the dates are getting near. And sometimes when they pass the date, hey, why my baby is not out? Why my baby is not out? Is something wrong? So anxiety happens to creep up, and you find that a lot of them who are having hypertension actually have this type of issues.
Thank you, doctor. Thank you for that, because that is also one part. When we talk about physical, mental alertness or mental resilience, I think it's another topic that we always want to cover. I know we have more topics that's lined up, but we also have a viewer right now, which I'm just reading to you. It's a guy. He said, "I'm watching, can't contribute much as I have no relationship and all children." LOL, laugh it out loudly, just knowledge. So yeah, so probably you will get to know more about it when you start getting, not say getting, you should get married, and then you should experience this wonderful process of starting, being single, married, and then a father. You see the status changes as it goes on. Thank you, Dr.
Actually,
Arvind.
sorry, Vince. Just
Yeah.
one more thing is,
Yes.
it's always good to know what the other partner is going through, because it's a team thing. Even though the lady, I always call the lady the captain, because she is holding the entire team together. She has to, she's holding the father together at the same time. She's a to be the mother, and then she's also catering for the fetus as well. It's a team event. It's a team effort. But I think everybody should play their role within, and the mom should play a role. The to be father will have to play a role. There are many things which can happen within the time, and it's a team effort. I think it's always a team effort when you get pregnant as well. So why should it not be a team effort until the baby comes out, or even after the baby is born? So it's a team effort, I think, from the word go.
Doctor, at this point of time, I think we have to give the greatest appreciation to the woman, because she endured not only the pain. I'd just like to mention that during the childbirth, the amount of pain that she goes through, if we measured, because I was reading an article, it's about what can we relate to the pain of delivering? Is there a thing that we can relate to?
You can't measure it. Let me just share with you that when a lady is delivering, and sorry to be a bit graphic, but as when the vagina is opening, and then you don't want the vagina to actually tear into the anus, because it can actually cause a lot of infection issues, and at the same time it's very difficult to repair. The mom may have a lot of problems later with defecation in the later years. So what actually happens is they make a cut called an episiotomy, meaning the vagina is here. They make a cut this way, so that when the tear happens, it happens away from the anus. And can you imagine that when she is actually delivering the baby, and the crowning is happened, and the contraction is happening, when we actually make this medical cut, she doesn't feel that pain, because the pain of the pushing of the child down and the womb contracting is much more painful. When you and I know that when a man undergoes a circumcision, right, they need all the anesthesia which they can get. So that, and can you imagine when that happens, very rarely do they actually do they have time to give anesthesia, or do they actually give anesthesia, because the mother actually doesn't feel it when the womb is actually contracting. That is how much of pain, there have been many scientists who have tried to actually compare whether breaking a bone is more painful or whether giving birth is more painful. most of the time they said that when they compare Dalton, pain is compared in terms of Daltons. I think even breaking a bone comes doesn't come quite as near as actually delivering a child. The only difference is that the pain is gone once the child is out, while a fracture lasts longer. But if you're talking about acute pain there and then, I think that I don't know. From working with Dr. Tham for many months, I would say I don't think a human undergoes that much of pain ever physically.
So that's a saying goes, right. I mean, don't mess with a woman. She's not compared to anything. She can be a volcano, she can be a sea, she can be anything she wants to. So don't mess with women. Great appreciation to the womanhood, because she is often called as a mother nature. She has all the patience. She can endure everything. She can create a life. She can destroy a life. She is the powerful woman that we have talked about today, Dr. Arvinda.
Yeah,
And it's always great to have you in Kopi Events as our guest speaker on different topics and different insight or sharing of wisdom and the knowledges as well. So it's time to say goodbye, but we are going to come back again on Wednesday at 10 p.m. This time we are going to go into a little bit more into the depression, anxiety, and we are going to talk about suicidal, because it's been a recent cases, not only in every particular country, everywhere it's been an issue. Certain things are signs and symptoms to be identified, even though it's a taboo issue, but I don't think so it's a taboo anymore, because it's about awareness. Of course, with great appreciation with the doctors who are going to come on board, like psychiatrists, neurologists. We're going to talk about more on that on the upcoming weeks of Kopi events. Thank you so much, Dr. Arvinda. We're still connected, and I'll catch you again.
definitely,
Thank
Vance. Thank you for having me on the show. Thank you.
you so much. Thank you so much. All right, thank you, viewers. We have come to the last part of the show. We have spent almost about 1 hour and 25 minutes at Kopi Advance. As usual, I'm drinking the coffee. Hope you are also drinking. If it has benefited you in any aspects in terms of knowledge, please do share the video, because at the end of the day, it's all about creating awareness and knowledge. As what we say, social media can be very powerful. So we want to reach our fellow viewers and friends through Facebook and other social media platform as well. So I'll be back again next Wednesday with a different topic on mental resilience, mental toughness, and we're going to talk a lot of other issues as well. What pushes a human being to do suicidal, and how a person go through that enormous painful threshold. And these are the things that we talked about with psychiatrists and neurologists. So we are going to bring the experts in to talk about that. And these topics, we are not expert at all, but the signs and symptoms are real. The kind of suffering they go through can be real. Either it can be a marriage unsuccessful, or whether going through a financial situation, or when a decision is not being able to make, they go through a tremendous stress. And how are we able to cope up with that, with the current situation, with the current COVID and ever-changing situation all the time? So thank you so much. Please do share the video, and I'll catch you again on Wednesday at 10 p.m. Signing off, Vance from Kopi with Vance. See ya. I'll catch you again. Adios, amigo. Okay, we have one more comment that came in. Oh, okay. Yeah, it's a comment for Dr. Arvinda. Thank you, Dr. Arvinda. Tracy has sent you. Thank you, Tracy. Thank you, everyone. Thank you, viewers. Catch you all again Wednesday, 10 p.m. Good night. See you all again. Sleep tight. Ciao.